All right, we will move on then to presentations as we have the health corridor update. And Ben, you're here to give us an update on that.
Good evening, Mayor and Council. Thank you for having us again for our third of 4 updates. As you can see, I'm not alone this time. We've made some headway. We've got a lot more ground to cover, so there's the whole team is here. Kaya Nesbitt with HDR is our project manager. Andy Parks with Leland Consulting is crunching the numbers, and then Dan Baker is with HDR here in Coeur d'Alene as well. So I think everybody knows the health corridor relatively well, but just as a quick refresher, it's the interstate down to Davidson between Government Way and Northwest Boulevard, essentially. Excuse me. And you'll see a lot more detail on this as we jump into the presentation. I should pause for a moment, let you know that just because of file sizes, what's in your packets is a little bit less detailed than what we'll show you tonight as we're going through. So if you see something that you hadn't seen before, that would be why. And then, Kaya, I think I'll just turn it over to you to run with it.
Thanks, Ben. Thanks. So my name is Kaya Nesbitt. I'm the project manager for the health corridor and the lead for the design team. Over the last couple of months, we've been working diligently with the community, with stakeholders on this exciting project. Just as a reminder, there are really 3 main things we've been working towards with the health corridor master plan and economic feasibility study. First is to create a master plan that focuses on creating a vibrant, health-based community development within the district of the health corridor as it was defined. Second is to evaluate economic feasibility of an implementable urban renewal district, which delivers community value. And third is the duration of this study is 5 months long, so it was really a sprint. The intent was to have the study wrapped up by the fall of 2019, so we're just in the last couple of weeks of our work, in order for an urban renewal district to be created by the end of the year. And this is not just an isolated project in and of itself, it's building upon work that's already been, great work that's already been done in the community, including the 2030 plan, of which I highlighted the overarching vision of creating greater Coeur d'Alene as the vibrant heart of North Idaho. So this outlines the 5-month process that we've been involved in. The key thing here is it's not just a vision, but also a development of figuring out how can we make this an implementable vision. So you see the blue really defines the master plan process, and then the green defines the economic feasibility process. Right now, we are currently here, so we're at the final presentation to City Council. This is the 3rd of 4 updates that we'll be giving to you, so we'll have our local team returning in September to give you the final update. We've been focusing over the last 2 months on the master plan itself, and working along part of that has been the economic feasibility aspect of it. But now that we have the master plan fully formed, we're really delving more deeply into the economic feasibility aspect itself. So you'll see tonight the final presentation of the master plan and some work towards economic feasibility, but that's still a piece that we're working on. So we don't have that fully finessed quite yet. I want to highlight that we have really worked hard on ensuring we have strong transparency with the community and stakeholders as part of this 5-month process. The yellow path outlines the multi-layered approach that we've taken, including multiple emails, stakeholder interviews, open public meetings, multiple open public meetings that we have engaged the community to participate in the creation of this master plan that has not been created in a bubble, just within the design group itself. We have essentially brought our studio here to Coeur d'Alene and engaged transportation professionals, urban design professionals, those who have been involved in the Urban Land Institute, and even some who were involved in the TAP study that was initially the instigator for this project in and of itself. We've also hosted pop-up meetings where we've had a chance to engage within Kootenai Health And we've done a number of door-to-door distribution of workshop results in an attempt to try and touch as many people within the community and within the district as possible. So one question that I want to start with is why redevelopment at all? Why is this something we're considering? And there really is, there are many reasons for that. Primarily, this is a way of taking a more proactive role in shaping the community. We know that there are a lot of the parcels of land within the health corridor that are for sale, and it is continuing to decline. There are a number of other areas within Coeur d'Alene that are seen as more appealing places to develop. So what is happening there is a degradation of that environment, and creating an opportunity for redevelopment will help stimulate a new vibrant community within the health corridor. It also creates a chance to preserve and attract additional jobs, grow the tax base, attract private development, and accommodate the changing market conditions. So what you'll see is a development plan that is not set in stone. It's intended to be a flexible plan that has some elements that are intended to be catalysts. There are a number of important barriers that should be highlighted as part of the health corridor. Some of these are quite unique to this place, different than some of the urban renewal districts that have occurred within Coeur d'Alene. We have a number of obsolete buildings. This map here highlights the parcelization. So we don't have as many large swaths of land that are really attractive for a developer to come in and make a big move. And so that can be a challenge and a limitation to development itself. There's also a limited road network, particularly on the east side of I-90. So access to this parcel, for example, is quite challenging. So those are some of the things that we have thought about in terms of what's important in creating the master plan. Bike ped infrastructure needs to be upgraded. We want this to provide mobility for all. It's important to think about car and auto transportation, but also bikes and pedestrian safety. And there are also few amenities for workers or residents. So what are the kinds of things that we can add into this place that will benefit the community overall? One thing that's really unique and interesting about the health corridor is the fact that we have Kootenai Health as a key anchor. So we term this a health-oriented development. Having a strong anchor like such a strong employer within North Idaho as Kootenai Health is a fantastic thing to build off of. Kootenai is a very important partner, and so as we've developed the master plan, we've been thinking about ways that we can benefit and support Kootenai as well as the overall community itself. And as we do that, we think about Kootenai not just as an isolated health campus, but one that is integrated into the community and creates a mutually supportive growth within Coeur d'Alene. So this is our ultimate master plan. I believe copies of this were distributed as part of your packet. We'll also be uploading this to the Ignite CDA website for public viewing as well. This has evolved since our last charrette, which was our last public meeting, but it essentially has been evolving in detail. This is the plan that was approved in our last public meeting and presented, at least in sketch form, at the last City Council meeting last month. So with a limited time today, I won't be able to go over everything in detail, but I do want to highlight the fact that our design team was really challenged with not coming up with small incremental steps, but big moves. Things that would become catalytic changes for the health corridor and really help to take this into a future vision. But I want to highlight that this is a long-term vision. This is not something that will happen overnight. This is not something that the council or Kootenai or any single partner will be able to do in one fell swoop. This is a complex plan. It will require multiple partnerships, and part of the economic feasibility strategy is investigating all the different ways that we need to think about how to implement this. And so Andy will talk a lot more about that. But to first go through a few key elements about this plan. Number one thing that we heard from the community and from our stakeholders is that we need a stronger street hierarchy. What this does for us is, one, helps to smooth transportation mobility. Two, it helps improve wayfinding clarity. 3, it improves connectivity and permeability. We know that getting in and out of the corridor can be a challenge, but also even just getting within the corridor, even just walking across the street to Peak Fitness can be a challenge. So thinking about mobility as a multi-layered approach is important. And then lastly, developable parcels. So especially on the west side of I-90, you see that we've created a framework of streets that will essentially create more attractive development opportunities. On the east side, the big move is a north-south street that creates better accessibility and more developable opportunity just east of Highway 90. This is a vision for what is an important aspect of the plan, which is increasing density and a focus on placemaking. So in order to have the TIF financing and the funding to be able to create some of these public amenities, we need to have a little more density. That's not extreme, but this shows that we're talking probably 3 to 5 stories in the densest core at the heart. It also highlights the importance of streetscape amenities. And then at the last, what you see is creating these visible nodes and these anchors towards hospital expansion. So in that way, it's exactly what we're saying in terms of symbiotic balance between creating opportunities for the hospital to grow and evolve, but also great places for the community itself. In terms of mobility improvements, there's no single silver bullet. And so we've engaged a number of transportation professionals. We've also had discussions with KMPO and ITD about how can we improve that large-scale mobility improvement transportation, as well as at that fine grain. Here are a couple of those big moves that we're proposing. One is an I-90 overpass, where we've explored a couple different location options for that. 2 is the idea of a right-in, right-out off of Highway 95. We know that this is a challenge. We've had initial discussions around this, but this will continue to be something we need to work through. And then lastly, and most importantly, the realignment and relinking of Ironwood. So you can see it's a smoothing it out, creating, I'll show you the street cross-section, and Ben is going to talk a little bit about how that will get adjusted. And then punching all the way to 3rd, that creates yet another way of getting in and out of the district itself. One thing we heard loud and clear from the community and in our public engagement was the importance of neighborhood stabilization. We see the residential area to the south of the corridor as a fantastic area that is something we should build onto and connect more to, rather than changing too dramatically. Market forces may evolve it over time, but the opportunity for redevelopment really lies within these 2 cores, right around Kootenai itself and to the east of 95. So that's the area we propose focusing on. Another thing I want to highlight is the importance of trail connections. There was a walkability study that was done that recommended a connection to the Centennial Trail here in the northwest corner. We think that's a fantastic idea, and whether it requires an underpass or potentially a connection through, that's another piece that we've incorporated as part of our project list. I'll invite Ben to come up and talk a little bit about some of the mobility cross-sections.
Okay, we pulled together a couple different street cross-sections to try and get a better feel for what some of this would look like on the ground, or at least what our vision of potential future could be right now. This is a snapshot of Ironwood. Long-term, you can see the growth around it. The asphalt itself gets a little wider. The idea is to sneak in a parking lane along one side. But more importantly, the roadway is widened a lot to accommodate bicycles and pedestrians. There's actually a full cycle track plus a sidewalk on each side, just to let the bicycles and the pedestrians both flow freely through there. And then you see the streetscaping and whatnot to just basically clean it up a little bit, but it also acts as traffic calming to help everybody relax and slow down a little bit through there. That in conjunction with the master plan that you can see, the intersections make a lot more sense. It's a lot more predictable, and people can get through it and understand what's going on while they're doing it. There's a couple different ones shown here. First of all, a proposal for what Lakewood could look like coming in from the south. Again, it's a 2-lane road, which it is now, but widen it out, add some on-street parking onto it, and then again, get the separated dual-use paths where pedestrians and bicyclists can both operate and flow through. We came up with some of our own street names, so pardon as if they're a little bit corny, but a new health drive, which would be facing the hospital, really hard to see kind of, but just north of Ironwood, coming straight down to what could be a new front for Kootenai Health, where again, you've got the wide streetscape, you've got the on-street parking, and the bikes and pedestrians could both use it as well. Same theme as repeated on what would be Shopko Avenue, the north-south road that parallels 95 to the east. And then the other one is addressing the residential neighborhoods. We heard loud and clear that there's a need for some traffic calming in there, which makes perfect sense. Easy way to do that would be, coming in, cleaning up the intersections, doing some bulb outs. Maybe you do some very small center traffic island type deals to slow people down, just so those roads aren't overwhelmed with the traffic. Our residents are already starting to see those roads being used a little bit as a cutoff. So mobility's two things really. First of all, it's letting people be able to move freely and flow freely where they need to, but then it's also slowing it down and calming it down where it needs to be calmed down in the neighborhoods. So that, that's not all the ideas or anything, but that's a snapshot just to kind of help you understand thoughts right now.
Thanks, Ben.
Back to you.
So, as I mentioned, this is a long-term vision with the Urban Renewal District. This would have be a 20-year plan, but the time frame for actual build-out is likely quite a bit longer. So in terms of thinking about implementable phases and how we finance the public projects that are highlighted within this plan, I'd like to invite Andy Parks to join me with more explanation of that round. Thank you, Andy.
Thank you, Kaya. Good evening, Mr. Mayor, City Councilors. Andy Parks, this is my first visit to you, so I'll give you just a little brief background on me. I've been doing finance management consulting for local governments for the past 17 years, working with urban renewal as well as strategic plans for a variety of different things such as water systems, sewer systems, street systems, and so forth. Prior to that, was the CFO for the city of Bend, worked with the city for 13 years. Urban renewal was one of those key areas of responsibility that I had, and it's one of the places where I actually met Dave Leland, who is the founder of Leland Consulting Group, who I'm working with as a team member with this team. Dave just turned 80, had open heart surgery and so forth, and just reminded me, talking about this, that when I hired him in Bend, he said, if you're going to have a plan, have a great plan. And I think this is what this team is trying to put together for all of you. So together with Leland Consulting, we've been tasked with completing the economic feasibility of the vision desired by this community. And Kaya has done a great job of laying that vision out and what that all entails. On that task, we've made considerable progress. We've created the models. We've been modeling that, analyzing various components of it, the playoff of this versus that, change in assumptions and so forth. But we want to ensure before presenting, final numbers to you and a plan to you that, we've vetted this information fully, particularly with some other, partners that are key in this evaluation and this plan. With that, we want the economic feasibility, to be grounded in reality. That reality, is different, in every single community. It's got to be responsive to the market demands, not what we would wish it to be, but what we believe it would be based on research and analysis. There's certainly locally here, as Kaya mentioned, the hospital is a key player in this. They ultimately own about 30% of the valuation within the district. There's large developers, also other developers in that area that are going to be key to this. One major item is parking that we'll touch on here in a little bit in terms of the cost element. And then it's key to any project of this scope and magnitude to have early project successes. Okay, I mentioned this is, goes well out beyond 20 years. 20 years is the urban renewal district duration. It's, a key piece of the funding challenge in putting that together. There's other barriers, challenges that you've seen on this in any endeavor of this scope, magnitude, of this duration, is going to be a challenge and is going to have those things, and it's just figuring out and learning what you can learn and addressing those as best you can. There's also opportunities, a number of them that we'll talk about. To realize success with this plan, we're going to need to have the long-term public-private collaboration with a number of transactions. These are going to be small, some are going to be large. It's going to require not just TIF, local government money, but there's going to have to be other dollars as well.
Like what?
We'll get to that.
Okay.
Patience.
Well, you just stopped.
Well, not to compare this project to war, but you may recall how Secretary Don Rumsfeld answered a press question on planning efforts. And, there are known knowns. These are things that we know. We know there are known unknowns. That is to say, there are things that we know we don't know, but there are also unknown unknowns. There are things we don't know we don't know.
Stop. Please stop.
So as projects become larger, multidisciplinary, as Kaya explained, longer in duration, there are going to be more things that we don't know. These things will change over time. This plan, as you mentioned, is something that starts this. It's a launching point. It's an update. Updates will be necessary, and they will be appropriate. Some of the known knowns that we do know would be developers will develop if they find an appropriate return for the risk that they're taking. They will develop consistent with the framework that is established or that as it is modified. We also know that absent a framework, they're going to do whatever it is they can do that will make money. It'll be less structured. It'll be more individualized. With a framework, which is suggested in this plan, the development will be more consistent, reducing costs, both for them and for the local government. One known that's somewhat an unknown, or it could fall into all those different categories, may be the garden and site impact. We have a pretty good idea of the financial implications of this particular property. We know what needs to get done legally to keep this property into the boundary. It's has a very net positive impact to the district from a funding standpoint. It's a very visible project. It is potentially a very much early in the process, but it does require de-annexation from the Lake District, which has some historical precedents within the state of Idaho, as well as the city of Coeur d'Alene having done this with other districts. As far as the full build out of this plan, we're looking at something of the order of magnitude of $150 million in today's dollars. You can see from this that a big part of this is parking. Roughly 68% is parking-oriented costs. Transportation-related costs in total are around 27%, with 18% of that being local-type streets, the grid framework that you saw south of Highway 90. The bridge is another 9%, type of cost. So overall, look at transportation-related, parking-related type stuff, you're looking at 95% of the cost of this plan. And how do you ultimately, fund those type of improvements? So going back to the ability to ground ourselves in, what those financial resources may be, particularly through TIF. The Leland Group in particular went through a fairly detailed evaluation of the resources available to them to project out what the demand for the various types of development might be. And what they came back with is there'd be a wide range of various opportunities in housing, in a range of price points, senior down to lower entry points, ownership versus rental, retail development, office development, primarily in the medical office area, and then lodging. These types of development, from their forecast, looking out over a 20-year horizon, result in this type of anticipated impact. Bottom line, from a financial standpoint, and the timing is what shifts a little bit in this with, the development of the other infrastructure, but it's roughly $361 million. It represents a 5 to 6% growth rate on top of, any inflation that might happen in the valuation within that area. We've looked at that, from a financial standpoint. Is that a reasonable type number? What do we have that compare that to in looking at a number of other urban renewal districts similar to yours in terms of the level of complexity, the level of development, and the things that are in front of it? It's very reasonable, including looking at, your Lake District, which has a very similar growth rate of, that 5 to 6%. So we're anticipating this will create TIF that can provide significant contribution to address the needed infrastructure capital required. Looking at the mapping again on what that infrastructure looks like, again, you really don't have a grid system in place right now. It's almost like a homeowners association, and they've kind of built a street where they need a street or a driveway to get to a building, and it's been somewhat disorganized and, project by project. And this plan calls for bringing that back into more your typical street grid type system, a variety of different alternatives to move traffic around, provide that continuity and the consistency, the connectivity, not only within that area, but then across in connecting through the rest of the community. With that type of infrastructure in place, you then have the ability to see the type of investment that was mentioned a couple slides ago in terms of moving forward. And again, this is a full build out. The $361 million worth of development is but a portion of this development. So this is, again, going out and looking past that 30 to 40-year horizon. What we do know, I think, without the street network, it's very likely the private sector development is much less likely to find this as an attractive development location, and they will seek other locations. On the revenue side of things, where are we seeing the primary resources? Tax increment financing certainly is one that we've done quite a bit of analysis with. The early significant private sector developments, such as the motel development. There's some other office type work that, or projects that are being looked at as well. Those clearly add to that increment capacity. There's potential for federal and state assistance with the bridge, potentially other improvements that provide that connectivity to the state highway system. You do have some large engaged private sector and public sector property owners in that area that have expressed interest in seeing this plan move forward and providing financial assistance. Pilot, I mentioned earlier, with the Kootenai Hospital District, they represent a significant portion of this that's tax exempt. So certainly Pilot, since they're not ultimately paying any property taxes, anything that they do would create an issue potentially funding-wise. We're having conversations with them, with Pilot, and what is a reasonable amount to bring into that equation for them and for the from the development for the rest of the property owners that are participating.
Daniel, is that in Idaho code?
Payment in lieu of taxes?
Yeah.
It can be in many forms in terms of them making contributions, whether it's they're making a payment out of the goodness of their heart, or it's part of a development requirement that they're making these types of payments. So we'll work with your legal staff to make sure that that's something that is doable. It's something we've talked with, and I have not heard that as a challenge.
Thank you.
You missed that one.
Then certainly we'll be looking at developer contributions for any of these different projects. There will be varying levels that we've looked at, and certainly the intent is to try to, again, bring the barriers down so that private sector development can take advantage of these opportunities and move forward quicker, which, increases the return to the district. And then certainly looking at potential grants. Urban renewal, tax increment financing, redirecting a portion of property taxes, is a valuable tool for these types of, projects, providing funding for infrastructure and other barriers to development, increasing the pace of development and providing long-term sustainability. We believe that, the development likely will not optimize sites if not for urban renewal. It will continue to be done. Those that get done in that particular area will be less than maximizing their potential, even with a strategic plan. That would be, the case. But we believe, certainly with urban renewal, it's an investment that provides a very favorable payback period for the city and the other jurisdictions, and also an excellent return on the investment. Thank you.
So essentially today, we have for you the full build-out master plan expressed, and happy to take questions about that. As you heard from Andy, we're working towards the economic feasibility portion of this. We have some, he and his team have been working through a number of different models and different funding strategies. So as you've seen tonight, we're working into that. We do not have that fully fleshed out yet, but that's something we'll be working through over the next month or so.
Questions? Woody?
Just a few. 68% of the budget is parking, it said.
You want to come up?
Yeah, the money guy got to come up.
Yeah.
It's all about the money, bud. And being from Bend, and it's not Idaho, so we have to question it. So 68% of your funding is showing parking. So that's all public-funded parking. There's no private parking in that plan.
That's not a known.
What's that? Did you say that
That's
again?
a flexible type item.
There he goes again.
Yeah,
Okay.
it's flexible. This is going to be parking for private business.
Right.
And
Okay.
to whether it becomes a private facility or whether it becomes a public facility, that's being fleshed out and will be part of the funding strategies.
Okay, so the 68% of the whole is based on, this is what it's going to cost to do this plan amount of parking.
Correct.
Whether how it's funded is different. Okay.
Correct.
I noticed, I love the Straighten Road, but then I went and looked at a map. It's going through big buildings that are there right now. How do you do that? Tell me how you do that.
So we've done an evaluation of the existing framework, and there are some buildings that are towards the end of their life and potential to redevelop. Others may be more challenging, and we'd have to work through that. So this is a vision for the plan, actually working on a parcel-by-parcel basis to figure out how to navigate those is still to be determined.
Okay.
Yeah.
So what I see as a straight line may not be perfectly straight, or that particular curve.
That's correct.
I get the idea, but yeah, I see you going through some new buildings. I'm going, really? How do you do that?
Yep, we've done our best to show what the ideal alignment would be. Further studies will absolutely be necessary, both in terms of understanding the overall traffic as well as the alignment.
Okay. Ironwood the Third probably isn't going to happen. The church is adding on as we speak. We looked at that right away many years ago, trying to get across the Third. But I love the idea of it, unless we know somebody at the church, huh? No?
Not gonna happen.
Not that church. So when I look at this concept, this is a concept. I remember a concept for Riverstone many years ago. And then things were moving along pretty good, and then the economy tanked, and then everything changed. Mm-hmm. And I understand, they have to do what they have to do. So this really isn't, if we say, yeah, we love it, it doesn't necessarily mean it's going to happen exactly as you have planned it. Is that correct?
That's correct. Yes, it's a vision, and it's trying to address the challenges that we heard from the community, from the stakeholders, and that were identified. It's trying to pull together the best solution that the design team and the community could put forward at this time. The intent with some of the, with this plan is to really identify the list of projects that would be required to make something like this happen, and put some round numbers around what would kind of funding would it take to make this happen. As you highlighted, market factors can change things quite dramatically. That's why we didn't put a lot of emphasis on what each building exactly would be. Our emphasis was really more on the public realm and the public benefit, because the things like creating the grid, creating a park, those types of items would be more of that broad public benefit that we'd be able to control. Who owns which building and how the market changes, though that ownership is more based on a market fluctuation.
Well, the last thing I wanted to ask was, you have these, looking at the cool layouts and all the colors, that helped, thank you, was you think, or this vision appears that people that work in the hospital want to live there. Is that, I'm seeing all these multifamily neighborhoods with parks and walkways and streets and sidewalks and all that. Am I too old to relate to everybody living together in R34?
Well, the intent is not to just create a community only for Kootenai and their employees. The intent is to create a place within this 275 acres that benefits Coeur d'Alene holistically and helps to bring forward opportunities for Kootenai Health's growth, which includes their employees and future employees. So a couple of just stories that we heard from residents who are currently living to the south is their perception initially was, oh, this is a plan you're trying to create for Kootenai. But once we worked through the plan together with many of the residents, they felt like, wow, that park is something I would love to go to. If there were restaurants that would be for all of us, that would be a great place I could walk or bike to. So the intent is to create a district within Coeur d'Alene that provides another place for all Coeur d'Alene residents to go, as well as visitors, as well as employees. So it was intended to create a place for all.
Really nice. Thanks.
Other questions? Dan?
Thank you, Mr. Mayor. I have some questions and some comments. First is the use of the word parcelization. That's an interesting word, isn't it? Parcelization. I had to look that up. It's not in the OED. When this was originally presented to us, the word used was property assemblage. And it was referring to, I don't know, because it was kind of nebulous at the time, but it would be nice if the final report would indicate what properties needed to be assemblaged for this parcelization barrier that you've cited. And it also seems like, as Woody said, there's probably going to be a lot of stuff you're going to need to buy or condemn in order to make this happen. I mean, it's got to all come together, and it seems kind of expensive. It was interesting to hear that the hospital owns 30% of the valuation within the district. That's really big. But then Daniel mentioned this pilot thing, which I've never heard of before. And I just don't know if you can get, I mean, it seems it would be equitable if there was, everyone else is paying the TIF, if the hospital was contributing it, but I just don't know if there's any way to bind them to that. And that's not my issue anyway, but I'm bringing it up. It's very interesting that I've heard now for the first time that this is a long-term project, because when it was first presented to us, it was told that there was a rush, there was an immediate need. So it's good to hear that that was exaggerated. Because I know that tax increment financing doesn't work short-term. I mean, it requires a long-term investment. So, I mean, the way it was presented to me, it was almost like they were going to put the hospital on casters and roll it up to Rathdrum. It's good to hear that's not going to happen. Neighborhood stabilization. So you have this map and you have these properties that are south of, I guess, Emma, and we're going to leave our hands off them, which I thank you for I'm getting that impression that pretty much that's going to be kind of left alone. But then if it is, why include it in the district? So, yeah.
To answer that last question, I think as Ben has highlighted, we have heard from the community that there are traffic issues along both Emma and Davidson. There was consideration of that broader district to include and study those areas. The conclusion the design team came to was that's a valuable asset as a neighborhood framework, and our focus for development should be further north. But that to benefit the community, additional traffic calming would be a community benefit.
And that's a good purpose for urban renewal, so thank you. And thank you for all the people who live there. Yeah, and Daniel, you mentioned the thing about straight lines, having straight lines in the grid. You really got to drive this city. I mean, straight lines just don't happen everywhere. And so it's kind of cool when they do. But, I mean, if you have the time, drive north on 7th Street tomorrow, and you'll see what I'm talking about. Density. So we use the density word, which we were told at the meeting at the missing middle that we weren't supposed to use the word density anymore. But I like the word density. Are we talking about primarily commercial here, or mixed use, or residential? What's the density apply to?
We're talking about mixed use, and so within the plan, I can actually go back a little bit so we can speak to a few things. There's one. Within this core area here, this section here, we envision as potentially ripe for that medical office. So that would be predominantly commercial. Some of these areas could have retail on the ground floor, residential above. They could also be hotel parcels. This portion here would be a fantastic rec center if this alignment did mean that there was a shift of where rec center might become. Having that connection to the park would be great. We resisted a bit defining building types. Actually, I think you have some of that here.
Color map.
There we go. This one shows community rec center, medical office, retail, commercial, mixed use, ground floor level retail, hotel, multifamily residential, townhomes, cottage homes, and parking structures. So overall, definitely an intent of being fully mixed use, not any single use.
Cool. And I know, and when you talk about this increased density, we're also concerned with open space, green space, and I see you have that in there, and I appreciate that. Parking seems to be addressed, so that's good. The only other thing I was going to say, which is something when Ben was talking about the street layout, is just remember that not everyone in town is, 30-something, working at the hospital, able to jog every day while they're listening to their iPhone. There's a lot of disabled people and people who can't access these kind of features, so I hope you include those kind of designs and considerations. Also, this is the hospital. It is where you drive when you are sick, when you're going through treatments and stuff, and so consider that some of those people may want to be ambulatory a little bit. We need to consider infrastructure and access for them as well. So thank you.
Yep. Good point. Thank you very much.
Any other questions? Ron?
Yeah, in the funding part, you mentioned grants, and then you've got urban renewal. What if you don't have either one?
I'm less concerned with grants.
You what?
I am less concerned with grants. Would say without urban renewal, this whole thing becomes very, very, very challenging, and I'm not sure it would be able to pencil. You'd be putting the complete onus of correcting a number of issues on the private sector. They've had that opportunity to do that. It hasn't happened yet. Would they? Possibly. But urban renewal would certainly make it a lot easier for that to happen, facilitate that, and move the community forward, I think, in a much more timely fashion than without urban renewal.
Tony, did you hear that?
Kiki, you have something?
I just had one thing. In the economic feasibility piece of this, perhaps, or maybe through the URA, is that there going to be data about the number of people who will be working here versus the number of people living in the footprint and the number of people visiting in the footprint?
I don't know the answer to that. I can tell you that, just looking at the information I've read, it does track the number of employees. That is what is driving much of the counts as it relates to the medical office in particular. As far as whether they're living here, not living here, within the city limits, how far out. I'm not sure if that is addressed. We can see if
Just
it
seems
can
like we're
be.
dealing with, going through things like the missing middle and looking at, we have an influx of people moving here and visiting here. And this plan is going to draw both of those and more. And so I'm just wondering how that's going to track to say, how are we going to take care of those visitors within here and take care of visitors, patients, guests, families who are all there for this, short period of time that they're in the medical facility, but then also the people who work there, how many of them are actually going to be able to live there? So I'm just wondering if that's going to be addressed and how.
Well, I think one area with respect to visitors, and I think that's why you're seeing the hotel demand, 3 significant, developments, 370 rooms, and those are all in the not too distant future. One that you already have underway, a couple of other that, we understand are in that process of, moving things forward as well. And as, Kaya mentioned, there's a couple of other pad type things that are, anticipated or potential, longer term that, would potentially result in, certainly by the looks of this, you would anticipate that that's what would happen.
I think the only thing I would add to that is the market demand that Andy highlighted is based on the analysis of market demand for medical office as well as residential hotel, so that it may not be a fully quite as fine grain as you're asking for, but in larger larger volumes, we have a sense of where those market pressures are, and this plan is attempting to address those.
Okay.
Any other questions? Dan?
Well, just to kind of give feedback, I also happen to be on the Urban Renewal Board, and I think we have you there tomorrow too, but just to, kind of underline a couple of things more for the people who are listening in that, there are still some big decision points on that. That's what all of this is about. And making sure that I'm hearing and stating correctly that, it sounds like for this to happen, participation of urban renewal would be a key piece, and they'd be a key player basically to help make it happen. But by no means is this going to be all an urban renewal project. It's like, wow, they're going to take on this whole thing. Not, right?
Right.
It's not going to be all urban renewal by any means.
Well,
I mean the funding.
I can safely
fun-
say that.
yeah.
Yeah, the funding.
You mean that the funding of the plan is not all based on TIF
Right, to
funding? Is that
make
what
all
you're-
of that happen, hundreds of millions of dollars is not going to be all urban renewal if it happens.
Correct.
Okay.
Yeah, and that's why, with the list that Andy was highlighting, many different funding strategies are being explored.
Right, and I'm just emphasizing that.
Yes, thank you.
Any other questions? All right, thank you very much.
Great,
Appreciate
thank
it.
you.
Thank you.